Hi everyone, welcome back to my channel RN Navjot Talks. This is Navjot, and in this video we are going to talk something which is very important at this point, because many of the people, they have started applying for applications for NCLEX in Australia and America, but they still have some doubt if they should go for Iencap, and they want to know what is Iencap, or if they should go for NCLEX in other country, or should opt for this option like Iencap in Canada. So we are going to talk about both the ways. Okay, so let's talk about Iencap first. If you choose Iencap, Iencap is basically an exam which you have to give in order to become a registered nurse in Canada. If you have some gaps, like competency gaps, if your education from your home country when it's compared to Canadian standard, it doesn't satisfy CNO or the provincial body, and then they give you some courses or Iencap to do. So in that case, you can take Iencap. But nowadays, people are going for Australia, people are going for America board to get eligibility from them for NCLEX, and then they can represent that result to CNO or the provincial body, and then they will accept it. Like, it's for CNO. Okay, so if you're taking Iencap, this is going to help you in one more thing, that's called evidence of practice. If you choose Iencap and if you pass it, then you don't have to give any proof to CNO regarding your evidence of practice, because evidence of practice is one of the requirement. If you don't meet that requirement, even if you pass your exam and NCLEX, they still don't give you the license. But if you go for America or Australia, you pass that NCLEX, and then you give that result to CNO, it will be considered as a past result for Canadian RN. But because your evidence of practice is expired, so you need to go either back to your home country, practice some certain hours there, and send that your employer has to write that there's a form which you have to get it from CNO, and then employer will fill out that form. You have to fill out one form, and then you have to give that information to CNO, then they will give you license. Or there are other options, like you have to complete 400 hours of clinical in Canada, which is through some like CARE, which is through some agencies which are dealing with that. Or you have to, or if you're going for bridging, that's a different story. Then probably you don't have to go for evidence of practice, because you still have your internship done in Canada. So these are two ways. Now you have to decide. In my case, because I didn't want to go to India, or I didn't want to spend 400 hours here, because that's a lot of time, so I chose to do Iencap, because in one Iencap exam, if you pass it, you meet your eligibility for evidence of practice, you meet your eligibility for competency gaps, and you know that you pass your Iencap, and then you got eligibility for Canadian NCLEX. You don't have to transfer your license from other countries like Australia or America. So this is one way. So the second way is, if you have struggled a lot, you don't get any Iencap date, or if you have got an Iencap date but you're not prepared, you don't know how to do, what to do, and you feel low confident that you cannot pass it, so probably you should go for America or Australia for NCLEX, and then give that result to CNO if your evidence of practice is already met. Because there's so many students who are coming from India or other countries these days, so they are like fresh people. They already have their evidence of practice met, because it's good for three years. So if, let's say, you pass you graduated in 2019, you still have the evidence of practice met. For those who came in 17 or 16 or 18 and they're struggling with the evidence of practice because of COVID, they cannot move or travel, the Iencap is the best option for you. So in this video, I wanted to just give a little bit of clarification regarding which way you should choose, because people are still confused, right? So now let me give you a brief idea. If you pass your Iencap, like, what is Iencap? Sorry. So Iencap is an exam which will test you on all the competency gaps, 100 gaps, and they will try to test you on all of those things, competency gaps, and then they will make a decision if you pass it or not. There's MCQs and there's practical. MCQs, everything is written on CNO's website. There's some certain number of questions, not questions, there's some certain percentage which you have to obtain in order to pass MCQs. But in order to crack the Iencap exam, you have to pass both of the exams, practical and MCQ as well. People who pass the practical session but fail in the MCQs, they still fail the OSCE. So you have to pass both of them on MCQs and practical. In the practical, they will give you some stations, some simulated clients which are acting like the patient, same kind of stuff that the patient will give you the sign and symptom, will show you the sign and symptom. That's the same thing they're going to present in front of you. So you have to act as a registered nurse and do your stuff there. So after that, they will review your file, and then the CNO will review your result, and then will make a decision if you are eligible for your NCLEX in Canada. Once you pass your NCLEX, you get the result right away the next day. I got my license the next day. So if you go for America or Australia, you have to write the NCLEX for that country, and then you have to transfer that license to Canada. That's a little bit of like waiting time, but it's easy. Right now it's very easy to become a registered nurse in Canada, because even if you don't want to go for Iencap, you don't want to go to university, once you have your bachelor's degree in nursing, you're good to have your RN license in Canada. So this was something which I wanted to clarify, because people are asking questions about that. We'll see you in next video. I'm trying to make another video just right after this. If I get time, I'm gonna make it. Thank you so much, and don't forget to subscribe to my channel, and don't forget to share with your friends. Take care. Bye.